My name is Aly Kouyate, and this presentation is for the medical terminology course. Today is June 21st, 2025, and I am doing a medical case analysis on a 54-year-old man with headache and dizziness. For the case summary, the person in question is a 54-year-old man. His chief complaints are progressive dizziness. He has right ear tinnitus and mild headaches. As far as medical history, he has had a past concussion and experiences migraines. Recent changes to his health: there are no visual auras, and his sumatriptan medication is ineffective. He also experiences difficulty walking and biking. When his physical examination was performed, there was right-sided hearing loss, unsteady walking/gait. He had vertigo, which is dizziness, and an abnormal Reen test, which tests his hearing. Additionally, imaging was also conducted, and an MRI showed there was a 2 centimeter mass in his right internal auditory canal. So as you can see, this person is experiencing a lot of ailments in the right side of his body. So for medical terminology 1, you go with vertigo. To separate the word, its root is vert, which is turning or turn. And then ego is the suffix, and it means condition. So turn condition. And it's defined by characterization of spinning or movement, often caused by imbalance, which is common for those experiencing ear pain. And the medical terminology 2 is tinnitus. And the word separation, the root is tenet, which is a ringing or jingling sound. And then us, which is a suffix for condition or state. So a ringing, condition, or state. It's defined by a perception of ringing or buzzing in the absence of external stimuli. So it's coming, the root origin is inside the ear. And then the third medical terminology is neuroma. Separated into 2 words. Neur is for nerve, that's the root. And then oma is the suffix, and it's for tumor. It's defined as a tumor composed of nerve tissue, which are often benign. And as you can see here, it's shown on 2 and 1. So for the terms that I read there are common abbreviations used. Like MRI is short for magnetic resonance imaging. BP is short for blood pressure. And blood pressure can be defined by the stress that the walls of your veins and arteries experience when blood is going through them. And then abbreviation 3 is ENT, which is ear, nose, and throat. And these are usually used in the context of examination and those who specialize in it. These abbreviations are important because they provide a standardized abbreviation that helps avoid miscommunication and transfers messages efficiently. So it provides clarity as well. As far as the diagnosis, I most likely believe it is an acoustic neuroma, which is also vestibular squamosoma. The reasoning being, the MRI confirmed the 2 centimeter mass at an internal auditory canal. Secondly, there was a progressive unilateral hearing loss, tinnitus, and vertigo, which are also characterized by this diagnosis. There was a lack of response to migraine meds. And it's also shown that the Reen test supported conductive hearing loss. And it's a reliable method for finding out if a person has acoustic neuroma or not. And I've cited the source here. And lastly, the symptoms match the tumor compressing the vestibular cochlear nerve, which I also found is a characterization of acoustic neuroma. So as far as the importance of medical terminology, it provides a precise medical library to be able to use and provide patients with the safety that they're warranted to get. This avoids errors in treatments. It provides clarity when documenting, and then it also holds doctors accountable for how ethical their practices are and how standardized and professional they are. In doing this and providing precise medical terminology, there's a standardized core provided for all providers, and then it also respects the patient enough to mandate a proper description of what they're experiencing. In conclusion, I have provided the patient summary, the term analysis, abbreviations, a differential diagnosis, and the significance of terminology. And in doing this, we as providers are able to give the patients the care that they need in an expeditious fashion and transfer messages on patient history effectively as well. Thank you for your time. This is my works cited pages. I have 2 sources cited, one for the Reen test and one for the vestibular squamoma and the tumors.